I never thought that I would be a mental health campaigner, and like many other campaigners, sadly this came from personal tragedy. For me, it was losing my brother, Ben. Ben was 18 years old. He was the most incredible person I will ever meet. He was a fashion student, creative, talented, utterly charming, and loved by everyone he met. In 2010, he suffered with 3 months of severe depression, just 3 months. In that time, his mental health really deteriorated. He was sectioned, he was put into an adult mental health unit, and we saw him worsen really, really quickly. We felt the environment was really unsuitable for him. They didn't understand him and they didn't know how to care for him. On the 20th of December 2010, my brother took his own life. As a family, where Ben had been the light, there was a lot of darkness. It was 2 days before my 17th birthday. I didn't know what had happened, and I didn't know what had happened so quickly. I'm not going to go into what grief felt like, but it was a very, very dark time for our family, and one of confusion. A few days later, my mum, who'd been a real pillar of strength throughout this time, got together with our family and said, I want to set up a charity in Ben's memory. We all agreed something had to change. We didn't know how to run a charity, and we worked it out day by day, but we did know that things had to change. We didn't know enough about mental health. Ben didn't know enough about what he was going through, and the services which were ultimately supposed to keep him safe had failed him. We were just one grieving family, but we felt like if we could even make a small difference, then we should. In January 2011, we set up our charity. We modelled through, we learnt how to become trustees and keep our accounts and register with the commission, and we built something. All we knew is that we wanted to raise our voice. We wanted to tell Ben's story, we wanted to tell our story, and we wanted young people to know about mental health, to be aware of it before there was mental illness. We felt like if we could just help one person in Ben's honour, then we would have done what we'd set out to do. If you fast forward from 2011 to now, 7 years on, a lot's changed. In that time, as a family, we've fought tirelessly and campaigned a lot, and we've reached milestones that we never expected were possible. Alongside that, the national conversation has really, really opened up. Over the last few years, mental health has hit the headlines. There has been extensive coverage of mental health, some good, some not so good. Things like campaigns and documentaries, celebrities and the Royal Foundation have really helped bring it onto the agenda. And it really has helped to smash some stigma. But despite this conversation, the services haven't followed. We're still faced with tragic statistics, and statistics are lives, young lives. In this country, if you're a male and you're aged between 20 and 49, suicide is the leading cause of death. If you're a female from age 20 to 34, suicide is the leading cause of death, above all other accident and illness. And yet, mental health care gets 13% of the NHS budget. And youth mental health care gets even less. And we know how important youth mental health care is. In 2012, the Royal College of Psychiatrists found that 50% of adult mental health issues presented before the age of 14, 75% before the early 20s. So it makes the best sense to pour energy and funding into adolescent mental health care, because not only will you create healthier and happier young people, but you're also investing in their quality of life and their life chances. We know this, and yet we don't do it. Our services are severely underfunded. The waiting lists are terrifying. So we know that we need to fund services better, and we need to prioritise it when we're budgeting for the NHS. But I think we can do better than that. I think we can go further than that. I think we should reshape and rebrand adolescent mental health services and modernise them to actually work for the young people that we're trying to help. The last 7 years for me have been something of a crash course in mental health awareness. I've learnt so much, I've met so many people, and I've listened to so many stories. I by no means have the answers, but there's 3 key ideas that have been shared with me that I really want to share with you, and I think they're crucial to progress with adolescent mental health, from prevention and awareness right through to acute care. The first one of those is branding. Why is a brand so important? Well, for young people, it really is. If we want young people to be getting in touch with services early when they need them, to be talking about mental health before there's mental illness, and to be connecting with this conversation, then we need to be providing them with platforms and voices and services that they want to connect with. In a very small way, this is what we did with our charity. When my mum suggested, let's set up this charity, we all agreed that something needed to change. But myself and my sisters had real reservations. We didn't want our brother's name to become a charity case. At that time, age 16, I couldn't have told you the name of a mental health charity. They weren't even on my radar, and I certainly couldn't tell you one that I thought was cool. We wanted to create something that Ben would have been proud of, that he would have wanted to associate with. So we used his tattoos to inspire the logo and the name. We didn't put his name or the words mental health anywhere on it. And my sisters and I started to create merchandise, make social media posts, and organise events. My parents worked tirelessly behind the scenes, but to the public eye, it was a charity for young people, run by young people, and it worked. We created such a buzz, and whilst our events are fun and sociable, they gave us space for young people to come along and connect and have conversations they wouldn't have otherwise had. Even if the conversations happen after the event, that's valuable. And we know that this works. Authenticity, real stories, and good branding. Nothing speaks to young people better than those things, in my experience. And you can see it with online influencers. They're taking over from traditional marketing with the younger generation for a good reason. They provide authenticity. They're channels that young people can trust, and they like it. A few years ago, when a female vlogger put up a video talking about her panic attacks and anxiety, it was groundbreaking. It got 4 million views. Recently, rap and grime artists who are male have spoken out about their mental health. It had an astounding reaction from young men across the country, and they're supposedly our hardest demographic to reach. And this is because they're role models, they're people young people want to aspire to and want to associate with. So when they step forward and say, I'm going to talk about my own mental health, I'm vulnerable, me too. For some young people, that's life-changing because they've never heard that, and it gives them strength through stigma. We know this works, and we know this works nationally, and yet we constantly get told young people don't want to hear about mental health. They don't want to engage in conversations about it. I say wrong. It's just that it works when it comes from channels and voices and people that they like and know and trust. That's how we can start a proper conversation. The second thing I want to talk about is about how we brand and shape mental health and how we frame it. We still interchange the words mental health and mental illness constantly. They are not the same thing. We all have physical health and none of us deny it, and we don't change that with physical illness. Yet with mental health, we are always talking about mental health issues or well-being and separating them, when in actual fact there's a complete scale. I find the concept of a scale as being the most useful concept I've heard, to use with young people. And the reasons why are clear. If we all have a scale of mental health within us, it empowers you to know that you can move up and down that scale. There is a scary amount of young people that think if you get a diagnosed mental health condition, then that's it. It's a black and white line between a mental health condition and being perfectly well. And that's just not true. There's so many shades of grey and an entire scale. It also allows young people to think about the fact that if they slightly move down the scale, they might need some coping mechanisms. They might need support networks. They might need to go and see a doctor. If they move further down the scale, they might need medication or professional help. And all of these things are okay. It's just that it's within a scale. You won't be there forever. Recovery is possible. And there are so many ways to become proud of your journey. The diagnosis did not define you, and everybody is somewhere on that scale. It's also really important to then stress what we mean by mental well-being within that scale. We're not trying to aim to be right up here, euphorically happy every day bouncing out of bed. It's not a reality for anyone. Mental well-being is about being able to experience a whole range of emotions and coming back to a middle ground. And that's what we try and instill when we chat to young people. And it's so much more achievable than this idea of happiness, which is different for everybody. The other thing that's really important about the scale is that it encourages us to be proactive. We need to start thinking and talking about mental health long before there's mental health issues. We talk and read about physical health all the time, and we all take preventative measures, some more than others, to look after our physical health. We even teach it to children in school. We get them to do PE lessons. We get them to eat 5 fruit and veg a day, to have a balanced diet. And we do those things so that they know how to look after their physical health. It won't ultimately stop them getting a serious physical illness, but it will give them a better chance at wellness. And we can do the same with mental health. We can teach young children at school coping mechanisms, relaxation techniques, stress-busting techniques, resilience. We can get them aware of their mental health so that they can talk about it and seek help early. Now, some say it's too young. Why would we bring the conversation at that age? Well, I disagree. If 50% of adult mental health conditions are presenting before the age of 14, then we cannot afford to wait around. And the final thing I want to share with you in how we can really rebrand and reshape mental health is actually recognizing adolescence. And it sounds obvious, but the divide between under 18s and over 18s, the legal line between a child and an adult, stops us thinking about the whole category of people, from the early teens to the early 20s. When you're a 17-year-old, on your 18th birthday, you don't magically become an adult overnight. Nothing changes, but in the eyes of the law and in the eyes of mental health services, you do. And the care you receive is very different on the other side of that line. I want to encourage thinking about adolescents as a whole group. They are a unique category of society. They face a vast array of social pressures whilst they're navigating a very difficult developmental period, physically, mentally, socially, emotionally. And we know that the brain doesn't stop developing until the early 20s. So why aren't we recognising adolescence more? Why are we expecting 19 and 20-year-olds or 18-year-olds like my brother to receive adult mental health care, when in fact they're still struggling with the pressures of adolescence? Our young people today arguably face more pressures than ever before. Added pressures like social media, information overload, early exposure to things online like sexualised content and violence, drugs, alcohol, body image pressures. They're facing a lot, and yet our services don't match that. We don't know how to navigate these challenges, and the best way forward to do that would be to listen to young people. It's surprising when you work within mental health how little young people are actually listened to inform services to look after them. It's ironic. And whilst we need to increase capacity in our current services desperately, and we need to fund them, I think we can go better than that. Why don't we innovate? Why don't we use technology? Why don't we find new platforms and use new platforms to speak to young people and create creative solutions? We need more help and more support that suits them and to be platforms that they want to engage with. There's such a kind of opportunity to innovate and to lead on this and not just repeat what we've always done. And the best people to lead that would be young people. They know the challenges they face, they can give you insight into the struggles, and they're also technologically savvy. They could lead the technological revolution of mental health support, and yet we still don't give them credit for that. We should be embracing the chance to reshape and rebrand adolescent mental health. I personally think that we can do better than we currently do. If we really were to rebrand adolescent mental health from prevention right through to acute care, we would be prioritising it, we would be innovating, we would be embedding it at an early age, and we would be empowering young people to own their own mental health and to look after it. I don't have all the answers. I'm just one girl who lost her brother who thinks that better should be done. I know that Ben deserved better, and I believe that we can do better. Thank you.